Congratulations, you are pregnant with your first baby. But you have a big decision on your hands. Are you going to have a vaginal delivery or are you going to opt for a C-section? So in this video, we're going to go over the pros and cons of both, as well as give you my experience as both a pelvic floor therapist as well as a mom on having 2 vaginal deliveries as well as 1 C-section and what I experienced. I'm Hina Chef. I'm an orthopedic and pelvic floor physical therapist, owner and practitioner at Rebalance Physical Therapy in Philadelphia, Pennsylvania, a holistic orthopedic and pelvic floor practice. Now, if you like anything that pertains to holistic body, orthopedics, spine, and pelvic floor related things, then this is the channel for you. So do me a favor, hit that subscribe button below so you can stay up to date with all of our new content that comes up. Now, with C-sections, so many people are having C-sections. It's becoming more and more prevalent all over. 25% in Europe, 32% in North America, and 41% in South America. So if everyone's having a C-section, why shouldn't you? And so there we go. The pros of a C-section is the convenience of them. It's convenient for you, it's convenient for the family, it's convenient for your healthcare provider. So sit back, eat bonbons, look at your calendar and be like, yep, I'm gonna have a baby today. So that is kind of a nice plus. Now the other thing that's kind of nice is that the delivery part is actually pretty painless. I had my C-section, pretty easy peasy. Everything went well as far as like having the anesthesia and going through the surgery. Now that's not to say there can't be complications in that process, but in general, since it's scheduled and it's not an emergency C-section, most of the time it goes pretty smoothly. And then there's also the added convenience of you're not really pushing a baby out of the vagina. So a lot of the muscles and the nerves and tendons and ligaments down below in the pelvic floor area with a vaginal delivery are kind of saved. So you have less susceptibility to incontinence as well as pelvic organ prolapse. Now, that's not to say you can't develop that later on with time because, of course, you had to carry the baby for 9 months. So that doesn't mean you're completely out of the woods, but your risk for pelvic organ prolapse as well as incontinence is low. Now, for those of you who've never heard of pelvic organ prolapse, stay tuned to the end of the video and we'll talk a little bit more about what that is. Now, we have to talk about the cons because the pros, they seem pretty sweet, but there are cons and there's risks. Just like any other surgery, a C-section is that. It's surgery, and it's a major surgery. You're cutting through abdominal fascia, and you're getting close to some of the organs that are right behind where you have the incision for your C-section. Now, if we look at this pelvic model right here, most of this C-section scars are right in through here, right above this area called the pubic bone. But right behind there sits your bladder, then your uterus, and then your colorectal system. And if that scar develops a lot of scar tissue, which is common after you have a C-section, depending on how extensive that scar tissue is, it can affect any of those organs. But the other thing is, again, you're doing surgery and you're moving those organs around. And so when you move those organs around, there is a chance that some of those organs can get nicked. It's on the rarer side, but it can happen. So that increases your risk for things that are organ related. Now we're going to go back to the scar because with that scar, if that scar is extensive, and some of you who are more susceptible to say like keloiding and things like that, that scar can penetrate in and around this area of the pelvic cavity. And if it does, it can create bladder issues, bladder frequency, urgency, pain. It can also lead to constipation issues or intense gas pains. So really focusing and working and recovering from that scar tissue is going to be important at some part for many of you. Now, along with scar tissue, this also, from what research shows, is that this can create some subfertility or even infertility and stillbirth. So this is something that you may want to consider, especially if you're considering having more children. Is that scar tissue going to affect the fallopian tubes or the ovaries or things like that? Again, especially if you're susceptible to the severe scarring. And the other thing to consider is that if you are going to have multiple other pregnancies or hopes to have more babies, then you're probably going to also have to think about having another C-section. And if you have a third baby, a third C-section. Now, in rare cases, there is something called a VBAC where you can have a vaginal delivery with your second or third baby after having a C-section, but the risk is higher. There's more planning involved, and you really do have to talk to your healthcare provider to find out if you are a good candidate for a VBAC. But just think about if you're having scar tissue with the first, then you're going to have more scar tissue with the second and more scar tissue with the third. So that is something that is really something that you really do need to consider. Now, as far as the recovery process, with a C-section, there is the risk for more bleeding. There's the risk for more pain, especially after the delivery process. Once that anesthesia has worn off, you're going to be probably in some pain. Now, of course, there's medications to help with that, but think about it. You have stitches, you might have staples. It's going to be a lot harder to move around. It's going to be a lot more painful to move around. Your hospital time is going to be longer as well. And then, at least in my experience, there is this intense gas pain that you might experience because of this pressure difference between the environment and your abdominal cavity, and that can create a lot of trapped gas. So I had to do lots of walking, take lots of laxatives to get my bowels moving and to get that gas moving. So just be aware that that is something that you might have to consider. Now, the other thing that we do have to also consider is that what are the risks for the baby? Now, because there are humongous benefits for the baby actually coming through that vaginal canal and being bathed in all of your vaginal bacterial flora, unfortunately, with a C-section, your baby is not going to be exposed to that. Now, some of the research shows that there is some susceptibility for a C-section baby to be more vulnerable to allergies, to obesity, and breathing problems. Now, that has not been the case with my baby that I delivered with a C-section. She's great. She has a pretty darn good immune system, but that is something that you may want to read a little bit up on. Now, let's talk about vaginal deliveries and what are the pros of those. Now, obviously, if you are looking forward to really experiencing the natural process or the natural process with an epidural of having a vaginal delivery, then this is something you need to consider if you really want to have that experience that for thousands and thousands of years, women gave birth vaginally. And I know for me, I am glad that I did have my two first babies with a vaginal delivery. It was great that I was able to experience it, and I'm glad I had that experience. But I will say that I did have some complications with my first, which we'll talk about when we get to the cons. Now, with a vaginal delivery, you're also going to have less bleeding, less hospital time, and usually you're going to recover much faster. You're going to be able to get to your regular activities because chances are if you do have any type of tearing, which most people will have some type of tearing with their first vaginal delivery, usually the recovery is quicker. Now, what I've seen in the research is about 5% have severe vaginal tearing. I'll probably be in that 5% because with my first baby, I did have a pretty significant tear. And those tears can happen from the vaginal area down through and into the rectum sometimes, but they can also happen in these diagonal areas. Now, and in other cases, you also might have to have what's called an instrumental birth, where they have to use a vacuum or forceps to kind of pull the baby out, and that can also create tearing. And for some, if there is some risk to the baby because they really need to get the baby out quicker, then you might have to have an episiotomy, and that also has to be stitched up. Now, the good news is that with all of these things, that there is appropriate rehab, and with good holistic pelvic floor therapy, you can recover from these vaginal tears. And so don't be afraid. There is help out there and there's treatment out there. Now, let's get to the cons of a vaginal delivery. Now, with the cons of vaginal delivery, if you don't like pain, well, you are going to experience contractions, and you are, even with an epidural, you're going to experience the pressure and the discomfort. I'm going to call it discomfort because some people, you know, discomfort is a fine word, but you will experience the discomfort of having to push a baby through that vaginal canal. And for some people, again, it's totally worth it. I felt like it was totally worth it to experience that. So if that's something that you are worried about, if you're concerned about, then it's something that you might have to consider. Now, you can also develop during the birthing process, and again, this is rare, so it doesn't happen all that often, you can be susceptible to some orthopedic injuries. And what can happen is you can have sometimes separation of what's called the pubic symphysis. You can also have tailbone injuries right in through here. And you can also have something called, you can develop some nerve issues down in through here called pudendal neuralgia. Again, this is rare, but there are nerves that go through here, and if they get stretched from the delivery, sometimes you can experience some vaginal pain and pain after the delivery. That can sometimes affect your bladder function as well. But again, these are rare, but just certain things that you need to consider. Now, the other thing is you are more at risk for things like incontinence and pelvic organ prolapse or POP when you've had vaginal deliveries as well as subsequent vaginal deliveries. So there you go. Those are your cons. Now, with all of these, whether it's C-section or whether it's a vaginal delivery, both of these are going to need proper rehab. So whichever one you end up choosing, I can't stress to you enough how important it is that you recover well. And that is going to prevent long-term issues. So right over here, there's an eye that you can barely see. It's probably white. If you click on that, that is a link to our C-section and vaginal delivery recovery programs. It basically takes you from day 1 all the way until 12 weeks on how to recover properly with appropriate guidance and education from a pelvic floor holistic therapist. And so if this is something that's concerning to you in either way and you want the proper help, there's our information that you can help have a really nice recovery. So I hope this was helpful for you, and this gave you some tips and insights on the pros and cons of a C-section and a vaginal delivery. This really is an independent and a very personal decision. There is no right or wrong, so don't feel pressured into making a decision one way over the other. Take all of these things into consideration because you and your family, this is very individual for you. So if you guys liked this video and it was helpful for you, please give us a thumbs up and a like, and we'll see you next time. Take care.